Hi, I'm Dr. Eric Mazer. Our Ask the Doctor question for today is, what is patient centricity? On the set with me today is our expert, Dr. Richard Kaplon. He's the Section Chief of Cardiothoracic Surgery at Danbury Hospital. Richard, welcome to Health Talk.
Eric, great to see you.
I know you're very interested in the idea of patient satisfaction and patient centricity. Tell us how you're interested, why you're interested, and about the process.
So patient centricity really speaks to redefining the processes, redefining how we do what we do in medicine to make the patient at the core of the processes and the decisions, making the patient the focus, not you, not me, not the cath lab schedule, but what is best for that patient.
And how have you gone about doing that?
We've redefined our processes, the spaces that we work in, the appointments that we schedule for patients, trying to do joint appointments with multiple providers at one setting, trying to restructure the beds and the wards that patients come to so they don't get shuttled around the hospital, the conveniences for their loved ones to come visit, the convenience for them to be in one space, things of that sort, really making the patient the focus.
So you go back to think about really the experience from the patient's perspective and how can you make this easier and more informative.
We're trying to take a page from the service industry. We're not quite making it Canyon Ranch, but we're working pretty hard to get there.
And what are the obstacles to doing that?
Change is hard. We have very entrenched mentalities in medicine, and people don't like change. Physicians tend to be very autonomous, and it's hard for some physicians to be willing to work as a team, to let go of some of that autonomy. And so it's changing a culture. Culture change is hard.
That's very interesting. Unfortunately, we don't have more time to discuss this, but I think you're absolutely right about physicians. A generation ago, the autonomous physician was the model. Now the team leader is the model. And I think it's a big cultural transition. I couldn't agree with you more. That is all the time we have for today. I want to thank Dr. Kaplon for being on set today to answer the Ask the Expert question. Please share your comments and your questions with us by emailing healthtalk@newvancehealth.org. We'd love to hear from you. Thanks very much. See you soon.